40 PANCE Practice Questions Antibiotics with Answers and Explanations Part 3. Hello, welcome to the Science Guide ASAP Learning. Today, we are going to be practicing 40 PANCE style questions. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 21. A patient with a bacterial infection is started on a medication that inhibits DNA synthesis by inhibiting the activity of DNA gyrase. Which of the following antibiotics has this mechanism of action? A. Penicillin, B. Vancomycin, C. Ciprofloxacin, D. Erythromycin. Answer: C. Ciprofloxacin. Explanation: Ciprofloxacin is a fluoroquinolone antibiotic that works by inhibiting the activity of DNA gyrase, which is involved in DNA synthesis. This leads to bacterial cell death. Question 22. A patient with a bacterial infection is started on a medication that inhibits cell membrane synthesis by binding to phospholipids. Which of the following antibiotics has this mechanism of action? A. Vancomycin, B. Erythromycin, C. Polymyxin, B. D-doxycycline. Answer: C. Polymyxin, B. Explanation: Polymyxin B is a polypeptide antibiotic that works by binding to phospholipids in the bacterial cell membrane, disrupting its integrity and causing leakage of intracellular contents. This leads to bacterial cell death. Question 23. A patient with a bacterial infection is started on a medication that inhibits the synthesis of folic acid by binding to dihydropteroate synthase. Which of the following antibiotics has this mechanism of action? A. Cephalexin, B. Trimethoprim, C. Ciprofloxacin, D. Amoxicillin. Answer: B. Trimethoprim. Explanation: Trimethoprim is a folate antagonist antibiotic that works by inhibiting the synthesis of folic acid by binding to dihydropteroate synthase, an enzyme involved in folate synthesis. This leads to bacterial cell death. Question 24. A patient with a bacterial infection is started on a medication that inhibits the synthesis of bacterial RNA by binding to the beta subunit of bacterial RNA polymerase. Which of the following antibiotics has this mechanism of action? A. Tetracycline, B. Chloramphenicol, C. Rifampin, D. Streptomycin. Answer: C. Rifampin. Explanation: Rifampin is a rifamycin antibiotic that works by inhibiting the synthesis of bacterial RNA by binding to the beta subunit of bacterial RNA polymerase. This leads to inhibition of transcription and bacterial cell death. Question 25. A patient with a bacterial infection is started on a medication that inhibits the synthesis of bacterial cell walls by blocking the synthesis of peptidoglycan. Which of the following antibiotics has this mechanism of action? A. Vancomycin, B. Cephalexin, C. Erythromycin, D. Doxycycline. Answer: A. Vancomycin. Explanation: Vancomycin is a glycopeptide antibiotic that works by inhibiting the synthesis of bacterial cell walls by blocking the synthesis of peptidoglycan. This leads to bacterial cell death. Question 26. A patient with a bacterial infection is started on a medication that inhibits bacterial protein synthesis by binding to the 30S subunit of bacterial ribosomes. Which of the following antibiotics has this mechanism of action? A. Penicillin, B. Erythromycin, C. Tetracycline, D. Azithromycin. Answer: C. Tetracycline. Explanation: Tetracycline is a tetracycline antibiotic that works by inhibiting bacterial protein synthesis by binding to the 30S subunit of bacterial ribosomes. This leads to inhibition of protein synthesis and bacterial cell death. Question 27. A patient with a urinary tract infection was previously treated with ciprofloxacin. The culture results show that the bacteria responsible for the infection are resistant to ciprofloxacin. Which of the following antibiotics is a viable alternative for this patient? A. Amoxicillin, B. Doxycycline, C. Trimethoprim, sulfamethoxazole, D. Nitrofurantoin. Answer: D. Nitrofurantoin. Explanation: Ciprofloxacin is a fluoroquinolone antibiotic. Resistance to fluoroquinolones has become increasingly common in urinary tract infections. Nitrofurantoin is a viable alternative as it is not affected by fluoroquinolone resistance. Question 28. Which of the following mechanisms of resistance involves the modification of bacterial enzymes or receptors to prevent antibiotic binding? A. Efflux pumps, B. Enzyme inactivation, C. Target modification, D. Reduced membrane permeability. Answer: C. Target modification. Explanation: Target modification is a mechanism of resistance in which bacterial enzymes or receptors are modified to prevent antibiotic binding and inhibit their action. Question 29. A patient with a severe bacterial infection was treated with a broad-spectrum antibiotic. However, the infection did not respond to the treatment, and further testing revealed the presence of an extended-spectrum beta-lactamase, ESBL. Which of the following antibiotics is most likely to be effective in treating this infection? A. Cefepime, B. Gentamicin, C. Vancomycin, D. Azithromycin. Answer: A. Cefepime. Explanation: ESBLs are enzymes produced by some bacteria that can hydrolyze beta-lactam antibiotics, rendering them ineffective. Cefepime is a fourth-generation cephalosporin that is less susceptible to hydrolysis by ESBLs and is therefore more effective in treating infections caused by ESBL-producing bacteria. Please like, subscribe for more videos like this one and comment below for suggestions. Make sure to watch Part 4.